You are listening to Why I Vaccinate. I'm Ann Thomas. I am here with my co-host, Veronica McNally. And Veronica, we now turn to Dr. John Charpie. He is a pediatric cardiologist with Michigan Medicine. Dr. Charpie, welcome to the show.
Thank you. Thank you for having me. I appreciate it.
Let's just kind of start out and have you talk to our listeners a little bit about pediatric cardiology. Tell us about this specialty.
Absolutely. So, pediatric cardiology is the study of children who are born with structural or sometimes called congenital heart defects, where the heart is developed abnormally. But it's also a specialty that takes care of children who acquire heart problems during childhood or adolescence.
And I have a niece that actually benefited greatly from your work at Michigan Medicine. She was born with a defect, and the work that was done there was just amazing. Incredible, incredible work. And tell our listeners a little bit about what you can do to save these children and help them live normal lives.
Well, it's interesting, and thank you for that nice comments. About 1 in 100 children are born with structural heart defects, but the vast majority of these can be repaired, and these children can go on to live long, full lives into adulthood. So we've made tremendous strides in the past 2 to 3 decades with these children, and it's absolutely a rewarding specialty to see these children grow up and become healthy adults.
And one of the reasons we wanted to have you on the show today, Dr. John Charpie, pediatric cardiologist with Michigan Medicine, is to talk a little bit about myocarditis. First of all, what is it?
So myocarditis is just a general term that's used to describe inflammation of the heart muscle itself, and it often is associated with the heart not squeezing as well or having some degree of heart dysfunction.
And how is the vaccine affecting myocarditis or not getting the vaccine affecting myocarditis?
Well, so first of all, we need to put it in perspective. Myocarditis is a relatively rare disease. There's about 1.5 million cases worldwide, or about 10 to 20 cases per 100,000 people. So it's not something that a lot of pediatric cardiologists will see in their practice on a yearly basis, unless you practice at a large center like myself, where we see so many children with heart problems. But nonetheless, the vast majority of myocarditis is attributed to a virus, and it can be the common cold type viruses that all of us get. And why certain children are more susceptible to having a heart inflammatory response than others, we don't really understand that, but it seems to be more individual. Nonetheless, COVID-19 is one of those viruses that has been shown to attack the heart. It's very uncommon, but again, there have been a number of cases reported. And one of the reasons why we're so interested in the vaccine is because if you can get children vaccinated, this complication of myocarditis can be virtually preventable. And again, when children get myocarditis, this is what sometimes can bring them to the hospital and end up in an intensive care unit. And there have been a certain number of fatalities associated with myocarditis secondary to COVID-19.
And it's interesting, Dr. Charpie, with regard to this problem, you don't know what child is going to get it. So you might, as a parent, think, oh, my child's not going to get this. They're perfectly healthy. But kind of talk about that and explain to our listeners, our parents out there, you have no idea who's going to be affected by myocarditis.
Correct. And as I said, even with influenza or other types of cold type viruses, no one has any idea who's going to get those and end up in the hospital with myocarditis. So it's imperative that we get the vaccine because this is preventative. And even if these children get a COVID infection, it's going to be mild. And as Dr. Caldoun said, they're not going to end up in the hospital or in the intensive care unit. So it really is imperative that we get these children vaccinated, and ideally even the ones under 12 years old eventually, when the studies are there to actually support vaccination of those young children.
Now, once somebody presents with myocarditis, is it a death sentence, number one? And number two, how is it treated?
So it is not a death sentence. Probably the majority of children will recover with time. I think the second part of your question, though, is critical, is that most of what we do to treat them is just supportive therapies. It's to provide them what they need to get better on their own. And sometimes that requires some very sophisticated care and sophisticated technology to help support them through that. But the vast majority will recover. and will leave the hospital. Nonetheless, this is one of the known reasons why children have sudden death during childhood. So it is not unheard of to have a very bad outcome with myocarditis.
And Veronica, I know you've got some questions for Dr. John Charpie too.
Yeah, Dr. Charpie, thank you. Can you just describe how the symptoms appear in a child or adolescent when they present with myocarditis?
Yeah, and this is true both for COVID-19 and other viruses as well. So there's no real differentiator here, but most of the symptoms are very nonspecific, and that's part of the problem. They can be fever, they can be stomach pain, nausea, vomiting, diarrhea, a lot of the things that you think about when you think about normal gastrointestinal type viruses in children. So again, it can be very indolent and nonspecific. Some of the children will present with a little bit more of symptomatology attributable to their heart, like chest pain, like shortness of breath, like heart racing. But that's probably the minority. Most of the time, these are very nonspecific. And again, there are no specific therapies for these children either. So it's important that if you think your child doesn't look well and you know that they've been exposed specifically to COVID-19, but any other virus, it's important that you talk to your physician and make sure that they are safe and that you're doing the right things.
Can you talk about what is being discussed in the pediatric cardiology community about myocarditis and COVID-19 vaccination?
Well, that's a great question. I think it's really important that we just take a moment to differentiate the myocarditis that we know comes from the virus itself versus that which has been attributable to the vaccine. And now we're talking specifically around the vaccine. There have been a handful of patients reported in the United States and around the world that have had a version of myocarditis or myopericarditis associated with the vaccine. And we know this because they've had no other symptomatology related to COVID infection. And it's happened usually within 4 days after the second dose of one of the mRNA vaccines. And this is relatively new, just recently described within the past month or so in some medical literature. The infection itself is not the cause. It is related to the vaccine, and it is completely recoverable. We have brought these patients into the hospital because, frankly, we have been concerned. They've presented with classic symptoms of what seems like, for lack of a better word, a heart attack: chest pain, shortness of breath, heart racing, general malaise. And they've come to the doctor's office or come to the ED, and then we've run some tests on them, and the tests themselves almost look like a child having a heart attack. But in fact, it's a very mild form of myocarditis where the heart muscle has been impacted, probably as an inflammatory response to the vaccine. This has been transient. Every one of these children so far has recovered within a matter of days. And here we have had some effective therapies because it seems to be an inflammatory response. Non-steroidal anti-inflammatory drugs, aspirin, colchicine, other things that we know treat heart inflammation have all been effective in helping to reverse the symptoms. And these children have gone home with no apparent heart damage whatsoever. And this is exceedingly rare, much more rare than the myocarditis associated with COVID-19.
And can you talk about whether or not it's impacting one gender more than the other gender?
Well, we originally thought that it was a gender-related phenomenon, and I think there still is some suggestion that this happens in males more than females. But again, it's such a few number of cases. The most recent report in pediatrics was 7 patients. And we're talking about less than 500 patients worldwide thus far that we know about. Now, again, that's in the context of hundreds of millions of vaccines that have been given throughout the world. So I think there may be a little bit of a gender disparity, but we're not 100% sure yet because, again, the numbers are relatively small.
So if you have a parent who gets their child vaccinated and their child expresses any of the symptoms that you've described, what should they do?
I think at this point, they still should come to the doctor's office. We are gathering this information. We are still trying to better understand this acute inflammatory response to the vaccine. it is clear that some of the anti-inflammatories that we use can treat it, but I don't recommend that patients try to manage this or families try to manage this at home. I think we need to be under the care of a physician to make sure that, again, this is reversible and that there's no apparent long-term damage to the heart. And that's one thing that we're just starting to learn as well, is because this is newly described, we don't know what this will look like, 1 month, 6 months, 10 years down the road. So I think it's very important that we continue to follow these patients, gather the information, and make sure we better understand the long-term consequences of this apparent inflammatory response to the vaccine.
And you touched on this a little bit, and obviously Dr. Khaldun, who joined us today too, really stressed the significance of some of the poor outcomes from COVID-19 infection in children. So I want to make sure that our listeners understand, are you recommending that adolescents get vaccinated against COVID-19, even though there is a risk of this potential myocarditis?
Absolutely. Again, most children who get this disease, it'll be relatively mild, but there are a significant number that can end up hospitalized with a COVID-19 related myocarditis. And that is much more common, despite how rare it is, than any kind of response to the vaccine. And I believe 100% that we need to vaccinate every child that we can. And right now, again, it's over the age of 12, but that's where we are. And that's what I think we need to emphasize. And it's really critically important that that is the message that we give. Again, I am not concerned about the side effects of this vaccine right now in children. I'm much more concerned about the spread of this disease, both in children and the way in which they can transmit it to adults.
Dr. Charpie, there's one more thing that I'd like you to talk a little bit about for our parents and our listeners, and that is this issue of children having long-term symptoms after they've had COVID. Especially, I have heard in stories of high schoolers and young adults where they say, I had COVID, it wasn't a really bad case, but I can't breathe, or I'm still having some long-term problems. Parents need to know, you got to get that vaccine.
Yes. I mean, these are called the long haulers.
Yes.
And again, there have been multiple instances of persistent symptoms, many of which can be attributed to COVID-19 because they didn't exist before the patients got these infections. And they are lasting months. And they are very disabling for many kids, whether it's chronic headaches, chronic fatigue, other sort of malaise. And it really just speaks to the idea that this is not a unimportant infection in children. Because of the concern about myocarditis, because of the concern about significant complications of being hospitalized with COVID, because of things like long haulers. It is critical that we get these children vaccinated and try to prevent all of the symptomatology, and it seems completely preventable with the vaccine.
Dr. John Charpie, pediatric cardiologist with Michigan Medicine, thank you for spending time with us today.
Thank you. I appreciate it.
We really appreciate your expertise. You have been listening to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas on behalf of my co-host Veronica McNally. Thank you for listening, and we hope you have a great day.